It's happy day for you all to be here.
Thank you, sir.
Namaste. A very good morning to all of you. I'm Sulakshna. I'm delighted to host this inauguration conference here. And it gives me an immense pleasure to welcome all of you to the inauguration of Vertigo Balance Disorders Clinic at Polo, Jubilee Hills. We have with us the renowned professor, Dr. Michelle Staub. Welcome, sir.
Privilege to meet Dr. Eddie and his kind family. So I'm very moved to be here again.
Thank you, sir. We have our founder chairman, Dr. Apsi Reddy. Welcome, sir. Joining. So much. And our joining managing director, Dr. Sankita Reddy, accompanied by Dr. E.C. Vinekar, Dr. Ravi, and we have Dr. from Chennai, Dr. Katya. Welcome to all of you on the dais. Special mention and welcome to all the members from the media fraternity for being present here for the inauguration. Moving on to the conference, I hereby request Dr. E.C. Vinay Kumar to incept the proceedings. Please, Doctor.
Respected Chairman, Dr. Pratap Reddy, our distinguished guests, Dr. Michael Strupp, Mrs. Sangeeta Reddy, ladies and gentlemen, thank you so much for giving us time to be with us as we high-end vertigo and balance disorders clinic. As many of you know, about 30% of population suffer from some degree of balance disorders. And even though it's so common, it's very distressing because the patients suffer from that, they have to depend on others for their day-to-day activities. And we at Apollo have started this clinic and upgrading it now with the advice of Dr. Strupp, who's come all the way from Germany. So we want to give diagnostic and therapeutic treatment on par with anything else in the world. And that has been the requirement, and we're happy to be a part of it. So since it's such a common disorder and a good treatment is available, we request the media, electronic and print media, to spread the word around so more and more of these patients could get help and get relieved of this. Thank you very much.
Thank you so much, sir. Adding another feather to the family of Apollo, Vertigo and Balance Disorder Clinic, indeed complementing the mission of Apollo, bring care of international standards to the reach of every individual. May I ask our founder chairman to unveil a video that was being curated for the clinic and to share his words accordingly.
I don't look like I have a serious medical problem, right? This does not sound a serious issue. This can be like disease spells while climbing stairs, in a swimming pool, or while driving. And then
He's right. Vertigo can be extremely dangerous. Consult your doctor at once.
Issued in public interest by the Vertigo and Balance Disorders Clinic at Apollo Hospitals, Jubilee Hills, Hyderabad.
Thank you. A note to the media, the video is available on the digital media packs. It will be sent to you. Moving on, now I request Dr. Sangeeta Reddy to share her thoughts on the inauguration. Please, ma'am.
Namaste and good morning. It's a great pleasure to be amongst you, and especially a tremendous pleasure and privilege to be welcoming an eminent personality, Dr. Stumpf, in our midst, to be with us as we take a further step towards treating, curing, and enabling more patients in the population and keeping our population healthy. Dr. Stumpf has a tremendous background in the science of this space, but beyond that, is one of the most renowned researchers, has committed his life to searching for novel cures to bring relief to individuals in the entire realm of the ENT, and then going beyond vertigo to the early prevention and interventions in multiple areas that he was just talking to us about, including anti-aging. Of course, vertigo is an area of significant specialization, but also in the onset of Alzheimer's and other neurological disorders. I have great pleasure in welcoming him and thanking him for his presence here. I think that one of the outstanding features of a clinician is his ability to treat, his pursuit of research, and his humane touch and connection with his patients. And Dr. Stumpf has all three. And we are indeed privileged to have him with us. A word about the clinic. Like was said in the video, it seems a particularly benign problem to have a bit of giddiness here and there. But the impact for the individual and what they can feel is quite significant. And the danger it can cause if they have giddiness when they're climbing stairs, when they're swimming, when they're driving. And therefore, we have created this clinic. Your press note pack will detail the fact that the advanced features of the Vertigo Clinic include the tests like the stabilometry, the video head impulse test, the VNG, which is the video stagnograph, the subject visual vertical test, the dynamic visual acuity test, the cranioscopy test, the calorie test, and all these are non-invasive tests. So our pursuit is to find the actual reason that a person has this discomfort. And then going beyond that is a systemic approach to rehabilitation and treatment using medicine or the physiotherapy or other methods, which Dr. Stumpf will tell us much more about. I just want to end by saying this is yet another step in using science for the betterment of mankind, which Apollo is continuously committed to. Thank you all very much. And a special word of congratulations to our own clinical team who continue to seek across the world to improve what they can bring of advanced healthcare to India. And of course, to our chairman, who will leave no stone unturned to help any patient possible. So thank you all very much and namaste.
Thank you so much, ma'am. May I request our chairman felicitate our renowned doctor who has patients all over the world for vertigo. So please.
I will just give you the flowers. Yeah, over there. Come.
From the entire Apollo family, I would say, positive having this vertigo and balance.
May I take this one, Chairman, to the next section? Please come. Thank you, Doctor.
Thank you so much, sir. May I request Dr. Stubbs to give us a few insight on the inauguration?
And Chairman will speak last. Yeah.
So first of all, for me, it's a great pleasure, privilege, and honor to be here. It's also a personal pleasure to meet such kind people here, namely Dr. Reddy. It's very moving always to speak to him. So modest and most kind, warm-hearted. You can't believe it if you haven't met him personally. And I also met one of his daughters, and I got the same impression. So I would like to continue with a very positive statement. Nowadays, vertigo is diagnosable and treatable. And what the doctors have to learn, and this is we will also focus here on, is to listen to the patient. The patient is the best and primary source information for the doctor. And if a patient has vertigo, to be specific, there are just 4 basic questions. What is the time course of the symptoms, the type of the symptoms, the modulating factors, and the accompanying symptoms? And when it comes to the examination of the patients, there are also just 4 tests for the vestibular system. And if the question arises, is this a stroke or is it something benign from the labyrinth, we have 4 clinical signs. So mathematically spoken, it's very simple and it's easy. It's not trivial, but it's easy. And secondly, what we have elaborated over the last 12 years, the diagnostic criteria for all vestibular disorders. And every doctor can download them for free. And they're very precise also for clinical studies, so that we have uniform worldwide diagnostic criteria, which can be applied in every clinical practice, but also in research centers. And thirdly, and finally, once you have nowadays made a correct diagnosis, and also already mentioned by Dr. Reddy, you can specifically treat the patient. We have drugs which specifically work in certain diseases, as in Meniere's disease, beta-histine plus siligeline. We have vestibular rehabilitation for patients with a balance deficit, and we also have so-called liberatory maneuver to treat patients with benign paroxysmal positional vertigo. So my take-home message is vertigo nowadays, listen to the patient, examine the patient, you can make the diagnosis, and you can successfully treat the patients. And I think that will be also the success story of the upcoming center. We will further improve the logistics so that this is going to be an exemplary center also for all India and maybe Asia. And what we learn here and apply here can be spread to all the other Apollo clinics all over India. Thank you very much.
Thank you so much, Doctor. Now I request our chairman to have a few words for us.
I think November 5th, 2022 is another milestone in the history of healthcare of the nation. You know, September 16th, 1983, we promised saying that we will bring the best possible care for our people at home and give the very best. And I think the last 39 years, there has been a great transformation in the way healthcare is delivered across the country, not just Apollo. All other good hospitals have come in and made a significant impact, and I congratulate all of them. And you have seen this, how they manage the COVID, you know, the government and the private hospitals. And I think we all owe a great, appreciation for the tremendous services that the healthcare has done during this pandemic. when people were panicked at home, here they were working it is. So I think it is our continuous effort to see what more can we do? How can we address the several problems? It's not only being able to do the major cardiac and neurosurgeries and the oncology and the proton that Apollo has done, but what we need to see is a common problem like this vertigo and balance disorders is very significant. And I'm very happy, as I said, this day will be remembered in the history of Apollo and in the nation because Dr. Michael Stump is not just a professor of neurology, a professor who has specialized in these balance disorders and make a significant impact, done a lot of clinical studies, published done a lot of research and made a lot of publications and brought a newer way, how, as he said, to diagnose and then make them well. This is the most important thing. I think you must make this point. You diagnose and make this well. I'm a typical, I'm one of those admirers of him because I got the benefit of his advice. And today, I have not come to Hyderabad for the last 7 months. Today, if I'm here, thanks to Dr. Michael Stump. So I think this is the difference that we need to do. This is where I think Apollo will continue to strive. And his inauguration of the clinic today is just the beginning. But I think we'll continue to do clinical studies with him, continue to improve, and then take this to a larger cross-section of people from Hyderabad to probably all over India and also to other parts of Asia. So I think this is where I said November 5th, 2022 will be another milestone in bringing a major impact on people with vertigo, balance disorders, neuroautology, all of these different terms. But as far as that patient is concerned, it is completely disabling him. If you can make him well and bring him back into action, I think it will make a significant impact on the national prosperity, their family happiness, and individuals' strengths. So thank you, Dr. Michael. It's no ordinary words, I think, from all of Apollo family. And the patient's aspect, I think on their behalf, I would like to extend saying, you're a fabulous person. You're remarkable in what you have done. And we admire your contribution to on this day, to open this vertigo and balance clinics and offer this to a larger cross-section of people across this part of the world. God bless you all.
Thank you so much, sir. Indeed, a day that is being marked. As we near to the end of the conference, I would like to thank each one of you who has put in efforts to initiate the clinic and gathering here for the inauguration. May I request Dr. Ravi to address the gathering for a good note of gratitude.
Good morning, everybody. Yeah, we have been running Vertigo Clinic from last 3 to 4 years. It's a launch of the Vertigo Clinic for the general public to know that there is a discipline called as vertigo, which needs to be focused on. Most of the patients, they come to the hospital without knowing where to approach, whom to approach for vertigo. They roam from one doctor to another doctor. The average time which I have calculated for my patients to reach me for vertigo is maybe around 2 to 5 years. And 2 to 5 years is a long time for a patients to lose. So I feel that vertigo and balance disorder clinic, it gives a home where the patient can come and they can be assured that the treatment can be done. The diagnosis, the technology, and the experts we have. Yeah, we also have experts from Germany, Dr. Michael Stump. He has given few inputs, which we will take it forward and definitely we will improve on our standards. And I would like to thank everybody for coming today on Saturday. It's a busy day for everyone. Thank you so much for coming and joining us. Thank you. Thank you so much.
Thank you, Doctor. Thank you to all of you, to all the media fraternity and all the people on the dignitaries also. Thank you so much, Doctor. Thank you, Chairman. And by this, we conclude the conference. Thank you. I'm sorry. If you want to raise your questions, please do raise questions. That's it, sir. So thank you so much. And please. Not to, the press lunch has been arranged at the basement 3. All are requested to help themselves at basement 3.
Back. Okay, start. నమస్కారం ఈరోజు అపోలో హాస్పిటల్ జూబ్లీ హిల్స్ లో డాక్టర్ స్టూంఫ్ ఎక్స్పర్ట్ ఇంటర్నేషనల్ జర్మన్ ఎక్స్పర్ట్ ఇన్ వర్టిగో అండ్ మూవ్మెంట్ డిసార్డర్స్ వారు జర్మనీ నుంచి వచ్చారు. వారు మా చైర్మన్ గారు డాక్టర్ ప్రతాప్ సి రెడ్డి చేతిలో ఇక్కడ ఈ మూవ్మెంట్ డిసార్డర్ క్లినిక్ ఇనాగ్రేషన్ చేయబడింది. ఇది చాలా ముఖ్యమైన అంశం ఏంటంటే డాక్టర్ రవి గారు చెప్పారు, పేషెంట్స్ విత్ వర్టిగో అండ్ దిస్ మూవ్మెంట్ డిసార్డర్ వాళ్ళు దీన్ని ఎలా డయాగ్నోస్ చేయాలి, ఎక్కడ వెళ్ళాలి అది తెలియక ఆల్మోస్ట్ 2 to 3 years టైం వాళ్ళు సఫర్ చేస్తూ ఉంటారు. అది కాక ఒక స్పెషలైజ్డ్ డయాగ్నోస్టిక్స్, దీంట్లో 5 to 6 స్పెషలైజ్డ్ నాన్ ఇన్వేజివ్ టెస్ట్ అవన్నీ ఇక్కడ క్లినిక్ లో ఉన్నాయి. ఆ టెస్ట్లు చేసినాక మందుల ద్వారా ఫిజియోథెరపీ ద్వారా ఆ కండిషన్ కు చాలా రిలీఫ్ వస్తుంది. సో ఇవన్నీ చేయాలని ఈ ఇంటర్నేషనల్ స్పెషలిస్ట్ ని తీసుకొచ్చాము. ఈరోజు డాక్టర్స్ తోని ట్రీట్మెంట్ ప్రోటోకాల్ గురించి, మెడికల్ యాప్ గురించి ఎలా చేయాలా అన్ని డిస్కస్ చేశారు. మధ్యాహ్నం వచ్చి అందరి కొరకు ఒక సిఎంఈ ప్రోగ్రామ్, చాలా మంది న్యూరాలజిస్ట్, సిఎన్టీ స్పెషలిస్ట్, జనరల్ ఫిజిషియన్స్ అందరు దాంట్లో పాల్గొంటున్నారు. ఇది అపోలో హాస్పిటల్ది ఇంకొక ప్రయత్నం. ఆ ప్రయత్నం ఏంటంటే మన హోల్ వరల్డ్ లో ఉండే బెస్ట్ ట్రీట్మెంట్ మోడాలిటీస్ మా ప్రజలకు తీసుకురావాలని ఇది ఇంకొక అడుగు. మీడియా వాళ్ళందరికీ చాలా థ్యాంక్స్. మీరు దీన్ని తప్పకుండా పబ్లిక్ కి మెసేజ్ తెలపాలి. థ్యాంక్ యూ. నమస్తే. Hari, want to join picture? Please come. Dr. Ravi, please come. Dr. Vinay. Thank you. Thank you so much. Dr. Ravi, who's actually trained now heading our research. So to give a quick I wish I had had this. I expected the moment you do a better CV. You've got a tremendous background, but I'm going to add it in the press one. We'll make sure. You are very modest, but we should project the magnet.